Dear friends, followers of SFKSNM TV, once again, thank you so much for following us on this channel. This moment, this time, let us talk about a serious problem, a serious disease, but most people do not understand it or misunderstand it. This disease is called depression. Depression, what is it? What are the different forms of depression? What are the symptoms of depression? What illnesses often coexist with depression? What causes depression? How do men experience depression? How do older adults experience depression? How do children and adolescents experience depression? How is depression detected and treated? All these questions, we are going to discuss them here. We discuss also how nutrition and exercises and even medication, but medication we will not talk a lot about it, but even psychotherapy can play a big role in treating the victims. Friends, even though the medication and psychotherapy part we will not discuss in this presentation, but it is very, very important to be used for the patient to get better. When you combine all necessary treatments, the patient get better faster and prevent the occurring of the problem. So let's start the brief of description, then we go into detail of description. Brief description of what is depression. Depression is the most prevalent of all emotional disorders. This may vary from feeling of slight sadness to utter misery and dejection. It brings together a variety of physical and psychological symptoms, which together consist a syndrome. Depression is the most unpleasant experience a person can endure. It is far more difficult to cope with than a physical ailment. The growing complexities of modern life and the resultant crisis, as well as mental stress and the strain in day-to-day living, usually leads to this disorder. It also arises out of the monotony and the drudgery of daily routine. Without any meaningful variation in urban life, suicide is the major risk in extreme cases of depression. A short definition of depression. Let's see the details and even different forms of depression, but in details, not in short, as we have seen in the part 1. Everyone occasionally feels blue or sad, but these feelings disorder, it interferes with daily life, normal functioning, and causes pain for both the person with the disorder and those who are about him or her. So you see how depression affected the whole family just by having one person who is in crisis. Because the caregivers also suffer the effects of depression when they have someone in crisis. It is well understandable. Depression is a common but serious illness, and the most who experience it need treatment to get better. Many people with a depressive illness never seek treatment. Why? Sometimes they don't know, they don't mind. Some people think like it is a normal, it's a slight change in life. It's not as serious, but it is more serious than people can think. But the vast majority, even those with the most severe depression, can get better with treatment. Intensive research into the illness has resulted in psychotherapies and other methods to treat people with this disabling disorder. You see, it is the capital, the mind, the brain which is attacked. That's why this disorder is disabling. It causes the sufferer to be disabled to work, especially to perform intellectual duties. But the best thing here we can get on this part is that most who experience depression need treatment to get better. So there's no one who should neglect this disease. Now, let's see the different forms of depression. There are several forms of depressive disorders. The most common are major depressive disorder and the dysthymic disorder. Major depressive disorder, that is number 1. Also called major depression, is characterized by a combination of symptoms that interfere with the person's ability to work, sleep, study, eat, and enjoy one's pleasurable activities. Major depression is disabling and prevent a person from functioning normally. An episode of major depression may occur only once in a person's lifetime, but more often it occurs throughout a person's life. So meaning this major depressive disorder may get a temporary relief, but for coming next time, depending on the triggers. Second, dysthymic disorder. Dysthymic disorder, also called dysthymia, is characterized by a long-term, 2 years or longer, but less severe symptoms that may not disable a person but can prevent one from functioning normally or feeling well. People with dysthymia may also experience one or more episodes of major depression during their lifetime, meaning this dysthymic disorder may pull some parts of major depressive disorder into the episodes. Number 3, psychotic depression. Psychotic depression, which is diagnosed if new mother develops a major depressive episode within 1 month after delivery. It is estimated that 10 to 15% of women experience postpartum depression after giving birth. So this is a depression of women after giving birth. It's just a passive period. That was the number 3. Number 4, seasonal affective disorder, CAD, which is characterized is less natural sunlight. That's when some people get this type of depression. The depression generally lifts during spring and summer. SAD may be effectively treated with right therapy, but nearly half of those with SAD do not respond to right therapy alone. Antidepressant medication and the psychotherapy can reduce SAD symptoms, either alone or in combination with right therapy. SAD is seasonal affecting disorder. Dear friends, some people may not find the case in these descriptions, but most of the time other type of depression are hidden into these 5 types. For example, depression linked to finance, depression linked to family problems, depression linked to other issues are hidden into these 5 characteristics of depression. So if someone did not find, for example, some people who are bipolar disorder, who have bipolar disorder, also called a manic depressive illness, is not as common as major depression or dysmania. Bipolar disorder is characterized cycling mood changes from extreme, example mania, to extreme low, that is depression. So these are 2 types of what we call bipolar disorder. There is an extreme high, that is mania, and extreme low, that is depression. This also is another type of depression, the bipolar about it. But the fact is that depression has so many forms and so many root causes. For example, like this one of postpartum depression. If a woman gives birth and accidentally the child dies or gets sick, that woman can develop this type of depression, even mixed with major depressive disorders, even can be mixed with bipolar disorder. So you see, this is a very complicated disease because it tends to hide itself and to get other forms to confuse people. Now let's see the more details about symptoms of depression. People with depressive illness do not all experience same symptoms. It's obvious. The severity, frequency, and duration of symptoms will vary depending on the individual and his or her particular illness. Symptoms: persistent sadness or empty feelings. That's one. Feelings of hopelessness and or pessimism. Feelings of guilt, worthlessness, and or helplessness. Irritability, restlessness. Loss of interest in activities or hobbies once pleasurable, including sex. Fatigue and increased energy. Difficult concentrating, remembering details, and making decisions. Insomnia, early morning wakefulness, or excessive sleeping. This is very important. Wakefulness and excessive sleeping all are symptoms of depression. Overeating or appetite loss. Thoughts of suicide attempts. Persistent aches or pains, headaches, cramps, or digestive problems that do not ease even with treatment. So you see how these things are very challenging. People get digestive problems, they get treatment appropriate for digestive treatment and do not respond to the treatment because it is being pushed by the function of the brain. So that's why the treatment of digestive disorders caused by depression cannot respond to medication. So it tends to be resistant. Very important. Now, we're going to see what illnesses often coexist with depression. What illnesses often coexist with depression. Depression often coexists with other illnesses. Such illnesses may precede the depression, cause it, and or be a consequence of it. It is likely depression and other illnesses differ for every person and situation. Regardless, these other co-occurring illnesses need to be diagnosed and treated. Anxiety disorders such as post-traumatic stress disorder, PTSD, obsessive-compulsive disorder, panic disorder, social phobia, and generalized anxiety disorder often accompany depression. People experiencing PTSD, post-traumatic stress disorder, often accompany depression. are especially prone to having co-occurring depression. PTSD is a debilitating condition that can result after a person experiences a terrifying event or ordeal such as violent assault, a natural disaster, an accident, terrorism, or military combat. So PTSD, it is connected with those things we have said. People with PTSD often relive the traumatic event in flashback memories or nightmares. Other symptoms include irritability, anger, outbursts, intense guilt, and avoidance of thinking or talking about the traumatic ordeal. The National Institute of Mental Health in US funded a study such as found that more than 40% of people with PTSD also had depression at 1 month or 4-month intervals after the traumatic event. Alcohol and other substance abuse or dependence may also co-occur with depression. In fact, research has indicated that the coexistence of mood disorders and substance abuse is pervasive among the US populations and even in other world nations. Depression also often coexists with other serious medical illnesses such as heart disease, stroke, cancer, HIV/AIDS, diabetes mellitus, and Parkinson's disease. Why? Because these diseases are terrifying. People tend to lose hope of life. So that's why most people who suffer these diseases develop depression. Studies have shown that people who have depression, in addition to another serious medical illness, tend to have more severe symptoms of both depression and the medical illnesses. More difficult adapting to the medical condition and more medical costs than those who do not have coexisting depression. Research has yielded interesting evidence that treating the depression can also help improve the outcome of treating the co-occurring illness. Friends, in this part, we're still describing types of depression. Friends, allow us to go into some information about the causes of depression. Depleted functioning of the adrenal glands is one of the main causes of mental depression. Irregular diet habits causes digestive problems and lead to assimilation of fats. An excess of carbohydrates like cereals, white sugar, coffee, tea, chocolate, and comparatively less quantities of vegetables and fruits in the diet may result in indigestion. Due to indigestion, gases are produced in the digestive tract, causing compression over a diaphragm in the region of the heart and lungs. This in turn reduces the supply of oxygen to the tissues, which raises the carbon dioxide level, causing general depression. The excessive and indiscriminate use of drugs also lead to faulty assimilation of vitamins and minerals by the body and ultimately causes depression. The use of aspirin leads to deficiencies of vitamin C, and antacid can cause deficiencies of calcium and vitamin B group. This is the side of causes in terms of nutrition. Diabetes, low blood sugar, hypoglycemia, and weakness of the liver resulting from the use of refined carbohydrates, processed foods, fried foods, and excessive intake of fats may also lead to depression. But depression can have other causes, which we are going to see next. Friends, let's go into details on what causes depression really. There is no single known cause of depression. Rather, it likely results from a combination of genetic, biochemical, environment, and the psychological factors. Such indicate that depressive illness are disorders of the brain. Brain imaging technologies such as magnetic resonance imaging, MRI, have shown that the brains of people who have depression look different than those of people without depression. The parts of the brain responsible for regulating mood, thinking, sleep, appetite, and behavior appear to function abnormally. In the people with depression. In addition, important neurotransmitters, chemicals that brain cells use to appear to be out of balance. But these images do not reveal why the depression has occurred. Sometimes some types of depression tend to run in families, suggesting a genetic link. However, depression can occur in people without family histories of depression as well. Genetics research indicates that risk for depression results from the influence of multiple genes acting together with environmental or other factors. In addition, trauma, loss of loved one, a difficult relationship, or any stressful situation may trigger a depressive episode. Subsequent depressive episodes may occur with or without an obvious trigger. Friends, we are going to see how different people experience depression, starting from women going to men, and we will compare. Depression is more common among women than among men. Reason? Because women are more emotions than men. That's one reason. Biological life cycle, hormonal and psychosocial factors unique to women may be linked to women's higher depression rate. Researchers have shown that hormones directly affect brain chemistry that control emotion and mood are more affected in women than men. For example, women are particularly vulnerable to depression after giving birth, when hormonal and physical changes, along with the new responsibility of caring for a newborn, can be overwhelming. Many newborns experience a brief episode of the baby blues, but some will develop postpartum depression, a more serious condition that requires active treatment and emotional support for the new mother. Some studies suggest that women who experience postpartum depression often have had prior depressive episodes. Some women may also be susceptible to severe forms of premenstrual syndrome, PMS, sometimes called premenstrual dysphoric disorder, PMDD, a condition resulting from the hormonal changes that typically occur around ovulation and before menstruation begins. During the transition into menopause, some women experience an increased risk for depression. Scientists are exploring how the cyclical rise and fall of estrogen and other hormones may affect the brain chemistry that is associated with depressive illness. Finally, many women face the additional stresses of work and home responsibilities, caring for children and aging parents, abuse, poverty, and relationship strains. It remains unclear why some women faced with enormous challenges develop depression while others with similar changes do not. How do men experience depression? After seeing women, and to see how men cope or experience depression. Men often experience depression differently than women and may have different ways of coping with the symptoms. Men are more likely to acknowledge having fatigue, irritability, loss of interest in one's pleasurable activities, and sleep disturbances, whereas women are more likely to admit to feelings of sadness, worthlessness, and or excessive guilt. Men are more likely than women to turn to alcohol or drugs when they are depressed, or become frustrated, discouraged, irritable, angry, and sometimes abusive. Some men throw themselves into the work to avoid talking about the depression with family or friends, or engage in reckless, risky behavior. And even though more women attempt suicide, many more men die by suicide in the United States and other developed countries. Now let's see how older adults experience depression. Depression is not a normal part of aging, and studies show that most seniors feel satisfied with their lives despite increased physical ailments. However, when older adults do have depression, it may be overlooked because seniors may show different, less obvious symptoms and may be less inclined to experience or acknowledge feelings of sadness or grief. In addition, older adults may have more medical conditions such as heart disease, stroke, or cancer, which may cause depressive symptoms, or they may be taking medications with side effects that contribute to depression. Some older adults may experience what some doctors call vascular depression, also called atherosclerotic depression or subcortical ischemic depression. Vascular depression may result when blood vessels become less flexible and harden over time, becoming constricted. Such hardening of vessels prevent normal blood flow to the body's organs, including the brain. Those with vascular depression may have or be at risk for a coexisting cardiovascular illness or stroke. Although many people assume that the highest rates of suicide are among the young, older whites, male, age 85 and older actually have the highest suicide rate. Many have depressive illness that the doctors may not detect, despite the fact that these suicide victims often visit the doctors within 1 month or of their death. Majority of older adults with depression improve when they receive treatment with an antidepressant, psychotherapy, or a combination of both. Research has shown that medication alone and the combination treatment are both effective in reducing the rate of depressive recurrences in older adults. Psychotherapy alone also can be effective in prolonging periods free of depression, especially for older adults with minor depression, and it is particularly useful for those who are unable or unwilling to take antidepressant medication. Now let's see, how do children and adolescents experience depression. Scientists and doctors have begun to take seriously the risk of depression in children. Research has shown that childhood depression often persists, reoccurs, and continues into adulthood, especially if it goes untreated. The presence of childhood, especially if it goes untreated, the presence of childhood depression also tends to be a predictor of more severe illnesses in adulthood. A child with depression may present to be sick, refuse to go to school, cling to a parent, or worry that a parent may die. Older children may sulk, get into trouble at school, be negative and irritable, and feel misunderstood, because these signs may be viewed as normal mood swings typically of children as they have moved. It may be difficult to accurately diagnose a young person with depression before puberty. Boys and girls are equally likely to develop depressive disorders. But age 15, however, girls are twice as likely as boys to have experienced a major depressive episode. Reason? Because of emotional development linked to hormones. Depression in adolescence comes at a time of a great personal change, when boys and girls are forming an identity distinct from their parents, grappling with gender issues and emerging sexuality, and making decisions for the first time in their lives. Depression in adolescence frequently co-occurs with other disorders such as anxiety, disruptive behavior, eating disorders, or substance abuse. It can also lead to increased risk of suicide. In some parts of the world, research have been done on adolescents, on 439 adolescents with major depression, found that a combination of medication and psychotherapy was the most effective treatment option. Other research done developing testing ways to prevent suicide in children and adolescents, including early diagnosis and treatment and better understanding of suicidal thinking. Some countries tried to put money into research to find out what can cause suicide attempt in adolescents, in young people. Now let's see how is depression detected and treated. Depression, even the most severe cases, is highly treatable disorder. As with many illnesses, the earlier the treatment can begin, the more effective it is, and the greater the likelihood that recurrence can be prevented. The first step to getting appropriate treatment is to visit a doctor. Certain medications and some medical conditions, such as virus or thyroid disorder, can cause the same symptom as depression. A doctor can rule out these possibilities by conducting a physical examination, interview, and lab tests. If the doctor can eliminate a medical condition as a cause, he or she should conduct a psychological evaluation or refer to the patient to a mental health professional. A doctor or mental health professional will conduct a complete diagnostic evaluation. He or she should discuss any family history of depression and get a complete history of symptoms. Example, when they started, how long they have lasted, the severity, and whether they have occurred before, or if so, how they were treated. He or she should also ask if the patient is using alcohol or drugs, and whether the patient is thinking about death or suicide. Once diagnosed, a person with depression can be treated with a number of methods. The most common treatments are medication and psychotherapy. But friends, on this issue, allow me not to enter into the medication using drugs, because they are specific for the people who treat using drugs. For us, we use nutrition. That's why for the treatment, we discuss only the part of nutrition, but other parts can be discussed with other people, not us, because we should not enter into details of medications, because some medications on this condition we are not fit to explain properly as a pharmacist can explain, or any other person in that field, because our field is complementary and nutrition. So allow me to stop from here and explanations about these issues, then we go to nutritional medicine. These two deficiencies of vitamin C, that's an example. Those people who use aspirin on daily basis, automatically they get into a deficiency of vitamin C. And antacids can cause deficiencies of calcium and vitamin B group. So those who use antacid many times, they risk to be deficient in calcium and vitamin B group. Diabetes, low blood sugar, hyperglycemia, and the weakness of the liver resulting from the use of refined or processed foods, fried foods, and an excessive intake of fats may also lead to depression. Meaning those who consume a lot of fats without consuming a considerable number or quantity of vegetables and fresh fruits, those people are at risk of developing depression. What is the cure of depression? The modern medical system treats depression with antidepressant drugs, which provide temporary relief but have harmful side effects and do not remove the causes of or prevent its recurrence. The harmful side effects include gross liver damage, hypersensitivity, insomnia, hallucinations, and confused state, convulsions, a fall in blood pressure which brings on headaches and dizziness, blurred vision, difficulty in inhaling, and urinary retention. The plan of action for self-treatment of depression consists of regulating the diet, exercise, scientific relaxation, and meditation. The diet has a profound effects on mental health of the person. Even a single nutritional deficiency can cause depression in susceptible people. Dr. Priscilla, Associate Clinical Professor at the University of California, prescribed nutritional therapy to build up brain chemicals such as serotonin and norepinephrine that affect mood and are often lacking in depressed people. Meaning, those people with the condition of depression, they lack these hormones, serotonin and norepinephrine. She recommends eating foods rich in B vitamins such as whole grains, green vegetables, eggs, and fish. I repeat, she recommends eating foods rich in vitamin B group such as whole grains, green vegetables, fresh green vegetables, eggs, and fish. Meaning, the people who are suffering of this case are advised to eat these foods. The diet of persons suffering from depression should completely exclude tea, coffee, alcohol, chocolate, and cola, all white flour products, sugar, and sugar products, meaning those refined sugars, food colorings, chemical additives, white rice, and strong condiments. All those products we said above should be avoided by the sufferer of depression because they favorize the accumulation of toxins in the body, which increase the risk of severe depression. The diet should be restricted to 3 meals. Fruits can be taken in the morning for breakfast with milk and a handful of nuts and seeds. Lunch may consist of steamed vegetables, whole wheat chapatis, and a glass of butter milk. For dinner, green vegetables, salad, and all available sprouts such as alfalfa seeds, mung, cottage cheese, or a glass of buttermilk would be ideal. Activity and exercise. The depressed mood can be overcome by activity, doing exercise, stretching, deep breathing, leg lifting. All those exercises can be helpful. Those who are depressed will forget the misery by doing something. So being busy, doing something which is helping the body to receive more oxygen will help the depressed person to get better. They should turn away from themselves and consider others. At home, they can take to decorating, repairing, or constructing something new. Meaning, be active. Being active in innovating something is a good medicine for depression. Of achievement overcomes the distress of misery. Exercise also plays an important role in treatment of depression. It is not only keeps the body physically and mentally fit, but also provides recreation and mental relaxation. It is nature's best tranquilizer. According to Dr. Robert Brown, a clinical associate professor at the University of Virginia School of Medicine, exercise produces chemical and psychological changes that improves your mental health. It changes the level of hormones in the blood and may elevate your beta endorphins, mood affecting brain chemicals. Exercise may also improve the function of the autonomic nervous system. So exercise is a very good medicine for everybody. Not only these people with the depression, but all people, because when you exercise while watching green color surrounded you, that one also can help not only to treat depression, but treat also stress, other stress effects. Exercise also gives a feeling of accomplishment and thus reduce the sense of helplessness. Some form of active exercise must be undertaken each day at regular hour. To be really useful, exercise should be taken in such a manner as into action all the muscles of the body in a natural way. Meaning, exercise for these people should not those kind of heavy exercises, but smooth and relaxing. Walking is one such exercise, and stretch and deep breathing. It is, however, so gentle in character that one must walk several kilometers in a brisk manner to constitute a fair amount of exercise. Stretches and deep breathing are very, very important in this case. Stretches should go along with relaxation and meditation on the Word of God, because the danger of self-reliance is developing depression. So people should learn to rely on the Creator, not on themselves. The patient must gain control over his nervous system and channelize his mental and emotional activities into restful, harmonious vibrations. This can be achieved by ensuring sufficient rest and sleep under right conditions. You must also learn the art of scientific relaxation and meditation, which will go a long way in curing depression. Relaxation enables the muscles to work more efficiently and eliminate fatigue by promoting venous blood circulation throughout the body and lymphatic drainage. The best method of relaxation is to practice stretches and deep breathing together. Meditation involves training of the mind to remain fixed on certain external or internal location. All the mental faculties should be directed without cessation to God. It can be achieved by constant practices. So those who pray, who practice prayer on daily basis, it can be a good medicine for depression to those people. So those who are suffering of depression and do not have the plan or in their activities, the prayer should include those practices, because it is a very good medicine for depression. Meditation will help create an amount of balance in the nervous system. This would enable the glands to return to a correct state of hormonal balance and thereby overcome the feeling of depression. The regularity of time, place, and the practice are very important in meditation. The regularity conditions the mind slowing down its activity with a minimum delay. The most effective times are early, dawn, and dusk, when the atmosphere is serene and peaceful. So starting practicing the relaxation and deep breathing early in the morning when the air is fresh, it's much better. But this one should be done where there is no noise. If it is possible, where it is applicable, the one with depression needs to go in a quiet area and practice the relaxation, stretches, just hearing the soft music in a peaceful place. A neuroimaging bath for 1 hour daily is also helpful in the treatment of depression. This bath is administered in a bathtub, which should be properly fitted without a cold water connections. The patient should lie in the tub after filling it where applicable, because all people cannot get these devices. So they fill it with water at a temperature ranging from 92 to 98 degree Fahrenheit. That is around 32, 34. The head should be kept cold with a cold compress. So this practice of neuroimmersion is not available for everybody, but the best is to use other application. But those who can afford this can do it. But what I can assure you is that stretches, deep breathing, brain reset, and consuming enough or abundant fruits and vegetables, as well as the food which can supply vitamin B group, vitamin C, calcium, and proteins, are very, very important things for helping this person with depression. Obviously, some essential oils are very helpful for depression, like rosemary is very helpful, and even eucalyptus can help, and cypress. Lavender can help for sleeping, and most importantly, the tea of chamomile combined with honey or jaggery and the milk, hot milk, are very helpful for these people who suffer from depression. That deep breathing is breathing in the air through nostril, then you stay for some seconds, depending on like as if you are blowing, and you push on top of your umbilical cord, 1 centimeter away from umbilical cord. You push, then you wait for seconds you have set, then you breathe out, then relax. You may even do it while sitting, like this. You breathe in and you push on the other point, then you stay for the seconds you are set, then you push, you breathe out. You do it again. Remember, while doing this, you choose to hold the air either 7 seconds or more, then you breathe out. Use these 2 fingers, then you push the other point 1 centimeter away from umbilical cord, then you breathe in. Okay? Then you breathe out. This exercise is allowing you to delete all negative emotions, all negative thoughts, all things you have mess you have seen. All those things, you can delete them from your mind and your body, and it is called brain reset. So you are resetting your brain to normal state, from the negative to positive. You breathe out. So the way you do it, you first pull in the stomach inside using the brain, then you push using your 2 fingers on the top of umbilical cord 1 centimeter away. Then after exhausting the seconds you have set, then you breathe out. Yeah. So when you have a problem and you have some injuries or some pain or somewhere or inflammation, that's where you put more thoughts. That's more you put where you put more energy, so that you may clear those toxins in those tissues. So while breathing in, your thoughts, your energies, all of them, you send them where you want to heal in yourself. Then you know that whenever you experience inflammation, your immune system goes there to fight. Then it creates the toxins or poisons, and that poison or those toxins can be cleared through these exercises, then juices and diet. So anyone who follows our channel and put in practice whatever we advise you, you will never regret. You will get more benefits. You will be quiet, you sleep better, you get better, and you do everything in order. So when you start having disturbances in anywhere in your body, so every activities are involved in that case, and then you find yourself not having good results in whatever you do. So when we tell you that you should use passion flower, passion flowers are good, but I cannot work alone. You should combine all advices we give you, not only one thing, but combination, exercises, food and fruits. Do not use one single advice to solve all problems, but try to combine. Let's go to the next step. Now we are going to do exercise which is called squat. Squat, you first stand on your top of your toes, then you make sure that the buttocks goes behind, then you come out. This squat, you make sure that you pull your stomach using the brain, so that one exercise is combined with other exercises, so that you clear toxins in your body. So let's repeat again, and you get straight and you go down using your knees to bend, then you go up, then you breathe out. You see how it is done. So when you have back problem, you feel it immediately. That's why those people with back pain, whenever you do this exercise, we advise you to apply first oil pack and the vegetable pack. Then it helps you to clear out those toxins. So mud pack, we no longer use it because we are not sure of the source. So those who ask us why we do not use it, that's the reason. We are not sure of the security or the safety of the source of the pack. That's why in our research we have discovered vegetable pack to replace mud pack. For those who know healthcare, for example, Phyto Nutrition Research Center, we used to use mud pack, but for the moment we use vegetable pack, and there's a time we show you the step by step how we make a vegetable pack, which will replace mud pack whenever we used to apply it on the body. So let's continue. let's say that you are using the chair, then you go down like that, this, and you get up. Then you breathe out. Then you do it again. Look how I'm doing it. Then you get up and you breathe out. Next, let's do it towards to show you how the buttocks should look like that. Go down like that, and you breathe out. Let me repeat again. Look at the buttocks, look at the knees, then up. Look, you should imitate what I'm doing. So let me do it facing you, and you see how it is done. The head is straight, and go down, then breathe out. You make sure that the back is straight, right? Go down. Remember, always breathe out. Yeah. So when you have a problem with the knees, it's better to apply the pack on the knees before you perform these exercises, so that that heating cream can help you to clear toxins into the joints. So that combination will help you to heal the injuries and inflammation in the joints, combining exercises and packs. So that's why it's much better. There's another exercise you should do. This is relaxation or brisk walk. Normally, when you have this problem, brisk walk is much better. Even when you walk outside, you better practice brisk walk. So when you are indoor or in the compound, so you keep practicing brisk walk as we are doing, like this, right? Do you see it? Yeah. It is more helpful, it is relaxing and warming. Look at it. It is like that. Look at the feet. I'm walking on the top of the toes, not allowing the heel to touch the sole. Then you breathe out when you finish. So you may do it before starting, or you do it in the middle of exercises. You may alternatively do this, the exercise of warm-up, breathing exercises, or rhythmic breathing, like this. You breathe in with more force on the stomach, then you breathe out. That one, it is sending more oxygen in the whole body. So that one can replace warm-up or all together done in the same time, simultaneously. So you may choose to use this exercise we're going to show you. Stretching the legs upward. Stretching your legs upwards while lying like that. Look. So that one helps you to clear fats in your stomach and help the muscles of your legs to work better, even the back. That one is very good. When you bounce legs, this exercise is very, very important. Yeah. So it helps you to burn fats while you lift the legs like that. So the stomach is working very hard. So next, follow what we are going to do. Another one, look at this. You may do the frog exercise, but not like we did it, but in another form. So look at how we do it. Touching the chair, then we look on facing in front. So you can use even other areas you have, like grillage, yeah, or of the door or the window. You can do it, or this one, yeah, the same. You remember to breathe out, then after doing it, you do relaxation and using brisk walk, yeah, so that the body may relax and the tissues which work the hard during the exercise may relax. This is the role of this brisk walk after doing that exercise we were performing. You see, the whole body is working. So you are supplying oxygen everywhere in the body. Then you breathe out. Yeah, deeply. Then you are done. Another exercise. Then this is the next exercise where you can correct kyphosis using this ball and sitting. You sit like this and you put on behind you. Then you stretch the chest while you pull your stomach using the brain, breathing in, and you breathe out like this. So you see, this ball was behind and you see how it is rough. Then it helps you to push the back and extend the chest, and you breathe in and you breathe out. You do it again, then you breathe out. So if you want, you can combine it with the eye exercises on 4 directions: up, down, and sides. So you can combine this deep breathing and chest extending with eye exercise. You can combine. So those people with sciatica inflammation and having pain under the buttocks, so you can sit on the ball, but not this soft one. You find the hard ball which cannot burst, but this one can burst. You buy like the other ball of basket or rugby, and you do this exercise while sitting on the ball. So that can help, yeah. So when you have sciatica nerve and you want this ball to massage you, so that's how you do it. It is very helpful. So you breathe in and you breathe out. You do it again and breathe out again. So you can help yourself to correct the incontinence. So you use the ball like this. Let's say you went in the party, or you went where there's a lot of people, then the toilets are limited. So you reach there and you find that you are unable to maintain the urine. So this exercise will help you to control the sphincter of your bladder. So you squeeze the ball while you put more force on the sphincter of your bladder, your urinary bladder. Then you breathe out. You do it as if you are going to urinate, but you don't have where to go. Let's say you are in the car, you are in the party, you are where you cannot find where to ease yourself. So this exercise will help to control that organ. So the more you do it, your brain will be used to control your sphincter on your urinary bladder. Anytime you need to ease yourself and you don't have means, so you can stop them, and you do it when you find where you can do it without having any accident. Yeah. So first of all, you pull your stomach while pulling also the other part. Then you breathe out and relaxing the other part. Yeah. The more you do it, you can do it anywhere. You can do it while you are watching TV at home. You can do it while you are sitting in the car. You can do it everywhere. So you are watching your TV at home, then you keep doing your exercise, ball squeezing, and you are strengthening your sphincter of the urinary bladder. So you make it a habit to help yourself. Even the parent, it can be, the children can joke with you that, "Mommy, you have forgotten your ball. So why don't you squeeze it as you used to do?" So the children, you are not, you don't have to explain each and everything. You have to put your sportswear and you start squeezing your ball. Then you help yourself. Those with incontinence, you will correct it with this exercise. You know that some medication can cause incontinence, and stress can cause it, even trauma. And yeah, this exercise can be done by anyone, from old people to young. All of them need this exercise because everyone needs the body to work better. No one wants to be disturbed by the body, but controlling everything. So when you want to urinate, you will never have any trouble of leakage, accidental leakage. The more you use this one, you reduce cortisol. Then when you are used to do this, you reduce even accumulation of fats in the abdomen. So this exercise also will help you to reduce cortisol production in your body, and because it deletes all things linked to stress in your body, so we not allow cortisol to be to prevail in your body. Use this exercise, and then this exercise should be done even before eating and after eating. For diabetics, it is a rule of thumb because they tend to accumulate fats in the abdomen, which results in more sugar in the blood. So you can even squeeze this ball between the arm to strengthen your chest. Yeah, this ball can be used in many ways. Yeah, we shall be telling you many things about exercises, simple exercises you can do. This exercise is a ball lifting we are going to perform. Look at the ball, how it is. So we're going to use it to lift it while lying down, as if you are in the exercise area during car-free day. Then you just lie down like this, or you can use it at home like this. Then you lift your ball like this. Look at it. Then you go down. Then you lift again. Then down. Let's say that you went in car-free day exercise, and then when you reach in the garden, then you use your ball like this. You lift it and down. You lift it again and down. Lift it again and down. So you have seen how to do it.